this webinar, and today's topic is digestion. Just want you to understand what's normal in your body, how your digestive processes are supposed to work when things are going right, and give you some indications of symptoms and signs that show us that things are going wrong, so you can know when you need to get something checked out. Okay. And if you guys wanted, if you have questions or you want to let me know if there's anything strange going on with slides or anything like that, go ahead and pop up in the chat and let me know. But gonna go ahead and get started here. So digestion, what's normal and what's not. First, as I mentioned in the advertising for this talk, proper functioning of your digestive tract is really central to your overall health. So as a naturopathic doctor, we've always seen it that way, that your digestive system is central to your overall health, and a lot of problems that are happening there show up in other ways in your body. They can show up on your skin, they can show up in brain fog, but a lot of things going on in the gut show up throughout the body. The reason I like to do talks like this is because knowledge is power. It's your power to know how your body works. That's what naturopathic doctors are here for. That's what I'm here to help you. I'm a doctor. That means my role is to teach you, to answer questions, to teach you about your body, how it works when it's working well, and what the symptoms are telling us when it's not working well. Symptoms like reflux, burping, stomach pain, bloating, excess gas, and constipation, while they're common, I'm sure you and your friends and your family are all familiar. You talk about, how bad you felt after you ate a meal or something, and everyone just takes for granted that this is just normal, this is what happens. But it may be normal, it may be common, but it's not optimal, and it's not things functioning well. So we want to talk about that, how it's supposed to work. Digestive tract includes all the things that are shown here on this little graphic, from your salivary glands in your mouth all the way down. So we'll talk about all these parts. One thing to keep in mind is we do live in really primitive human bodies. These bodies developed on this planet millennia ago, and the world was a very different place. So we live in a new, modern, technological world, but our bodies haven't changed to adapt to that. The difference in our sleep-wake cycles and the light and dark cues of having artificial lights and driving in cars that are, really rapid speeds and lots of information to have to process rapidly. That's not the kind of world that these bodies developed in. And so our digestive tract hasn't changed very much, but of course the foods that we eat have tremendously changed. One example being with dietary fiber. Dietary fiber in hunter-gatherer peoples and in people who still eat in a subsistence way, they get maybe 120 grams of dietary fiber per day from all the different roots and plant foods they eat. Americans, or people in the Western world, typically get maybe 10 grams of fiber a day. With the RDAs, or the recommended dietary allowance implemented by the USDA of our government, they recommend 30 grams a day for women and 40 grams a day for men and 50 grams a day for people who have a history of heart disease or want to prevent heart disease. So you can see the huge variation between what we eat now, what would be good for us, and what early humans were eating, dramatically different. Same thing with the way that we get our probiotics. Those probiotic bacteria that populate our gut are from the soil. And so that's initially how humans, interacted with these microbes, is picking up things from the ground, eating raw fruits and vegetables, eating raw leaves that have these microbes on them, and then they live in our gut. We don't eat that way now. We wash and clean and cook everything, and so those microbes are not coming from our food so much anymore. We take supplements for these. Again, because our bodies are still ancient and they still need those things, even though our current diets don't provide them. Another thing I want to say about the new world that we live in, as opposed to how these bodies developed, we now have cooked food, and the majority of our food is cooked and processed and broken down in ways that make it more available for us to readily get the nutrients out of it. But unfortunately, that means that a lot of us don't chew our food nearly as much as we need to, because it's already soft or mushed or broken down in ways that, it's not raw, it's not fibrous. We don't have to chew and chew to process it. The cooking helps us, but losing out on that activity of chewing is not good for our health, because chewing is a really important part of the digestive process, not just for breaking food down, although that is, a very important role, but also the act of chewing itself. The muscular action and movement of the jaw in chewing is an activity that is stimulated through a certain nerve in the brain, that is involved in calming us down. And so when we chew, it's calming to our nervous systems, and that puts our body into a state that's more ready to accept food and process it. So the next slide will talk about this. The autonomic nervous system, I don't know how many of you may have already heard of this, but this is what's involved with your fight or flight response. I think most people have heard of fight or flight, but the term for that is a sympathetic nervous system when we're activated into a stress mode. And then the opposite of that, our nervous system then is in a rest and digest parasympathetic mode when it is relaxed. So when our body is either stressed or relaxed, it functions very differently, and especially when it comes to digestion. So when you are in a stressed out state, something is urgent, you're driving, you're trying to get somewhere really quickly, that's not a good time to put food into your body, because it won't be able to process it. It can end up with reflux, food sensitivities, all sorts of things can come from eating when our foods aren't prepared and ready for food. When we're in rest and digest phase, of course, it says it right there, that's when we can digest and we're able to process food. Again, note the note at the bottom of the slide, an activity that shifts our bodies into parasympathetic mode, that calms our bodies down, is chewing. So if you take a moment before your meals to sit, to breathe, to think about it, to be engaged with your food, to be mindful about the moment you're in and what you're doing, you can take a few deep breaths, you can start chewing slowly, and that can shift your body into the mode where it's ready to eat. I don't know, did your family do prayers before meals? I think this is one thing that a lot of people have ritualized that helps, and a lot of other people have moved away from that. But again, just stopping before meals, making sure you're in a state where your body can receive food, will help it to work its best. So some of the, this slide is very much the same kind of information. Your digestive system is down-regulated. We use that term a lot in medicine. That just means something is not getting full activity. It's really slowed down. We can't say that when you're in stress mode that your digestive tract shuts off, because it's still functioning somewhat, just in a really diminished capacity. One of the things that's important to know is that movement down and out stops or slows dramatically when we're under stress. And the enzymes that our body produces to help break foods down so we can absorb their nutrients, those enzymes cease to be produced when our body's under stress. And parasympathetic mode, again, get home, tough day is over, we can relax, we can be calm. Then it's a good time to eat. All our digestive system functions are on go. Okay. Some terms to know. I just said something about enzymes, and that is a term a lot of people don't really understand. It's confusing to them. They oftentimes confuse enzymes with probiotics. So I'm just going to say these are a couple terms to know and understand that they're different. The enzymes are little substances your body makes, and it helps to make chemical reactions happen faster. And that's called a catalyst. When a substance helps a chemical reaction happen faster, that's a catalyst. Enzymes are catalysts for breaking down large food molecules into small absorbable molecules. One thing you'll notice if you ever, take a digestive enzyme supplement or engage with them in any way, you'll notice that enzymes always end in the suffix ase, ACE. And a sugar will always end in the suffix ose. So lactose is a sugar that requires the enzyme lactase to be broken down into small enough sugar molecules for us to be able to absorb them. This is something that people will maybe have a lactose intolerance, and what that means is their body is not producing an efficient amount of lactase enzyme to help their bodies break down lactose sugar. So it stays this very large sugar molecule, and then it could cause diarrhea, gas, painful bloating, and cramping. But just a little tip there, if you see it ending in ACE, that's an enzyme that's breaking something down. Besides, lactase, we have things like protease, which breaks down protein, lipase, that breaks down lipids, and lipids are fats. So there are a lot of different enzymes that are specific to the thing that they help to break down. And we make a lot of them inside our body to aid us in digestion. Then probiotics, those are living microorganisms. They're usually yeast or bacteria, and they confer a benefit to us by living inside our bodies. They're doing us favors. They're not there along for the ride. They're not being parasites. They're helping us by being there. But to be a probiotic, to be considered, to use that specific term, probiotic, these are microorganisms that must survive the conditions of the digestive tract, which means when you swallow them, they survive the acidic conditions of your stomach, they get into your intestines, and then they open up. So they have to survive in your digestive tract and live there, and they have to confer a health benefit to the host. So there are a lot of bacteria that are used, say, in fermentation of foods and drinks, but just because those bacteria are there, they're not probiotic. They're just really just fermentation. One thing I'm going to use an example of is kimchi, and not kimchi, that is fermented. Kombucha is a food that is purported to have probiotic bacteria in it. But if you've ever made it at home, kombucha doesn't have probiotic bacteria. It doesn't have any that survive in your digestive tract and give you a benefit because they're living inside your body. Those are just bacteria that are used to ferment food. And so they don't really do anything that's beneficial as far as a probiotic. That's a very specific term. Anyway, probiotic bacteria, that's something that lives inside our body and gives us a benefit. Enzymes are something that our body produces that gives a benefit, but in very different ways. Okay, now that we have those terms out of the way, let's get started. First step in digestion, it begins in the mouth, or to be even more precise about that, it begins in the cephalic phase. So digestion begins when we see food, when we smell food, when we think about food, when it's getting to be close to the time we normally eat, our bodies start preparing for food to come in. We start producing a lot of saliva. And think of like Pavlov's dog, right? Or if you have any pets, it's time to feed them. They are ready. They are drooling. Food is coming. Humans were similar. We start engaging our salivary glands when we start thinking about food. Also, our stomach begins to produce hydrochloric acid in anticipation of food coming down too. So everything starts with that. We produce saliva. It's not only for lubricating our food so that we can swallow it more easily, but it also contains one enzyme called amylase. Amylase breaks down amylose. Amylose is another way of saying starch. So that is just one thing that our mouth can start to do, is the saliva and the enzymes can help us to start to break down starches. So the digestion of those is already underway by the time they leave our mouth. Teeth crush and tear food into small pieces, right? What does that do? It increases the surface area so that the hydrochloric acid in your stomach and the digestive enzymes in your intestines can get all over that food and all the tiny, nooks and crannies and crevices. It's just a small amount of surface area, or the largest amount of surface area you can have just by chewing that food and breaking it down. Here's a big opportunity for improvement in most people, and that is that your bites of food should be chewed until liquefied in the mouth. Really chew it until there's nothing left to chew before you swallow it. I don't know about you, that's something I'm actively working on improving, because it has led to me having some problems with some indigestion and some stomach pain. So that's something I'm really working on. And I'll tell you, it's a really different way of eating. Instead of getting a sandwich and, cramming it in your mouth in 5 minutes, you're on your way. Really chewing and taking the time to eat a sandwich can take 20 minutes or more. So it's a different way of handling meal times. But really important that you chew just as much as you possibly can before you swallow the bite. Your tongue is active in moving food around. It's that big muscle. It can move food around in your mouth and help you chew it better. And also it's covered in taste buds, so you can taste your food and see if this is something that's good or maybe there's something noxious or bad in that food. So taste buds are important, but not just on your tongue. This is a fun fact I only learned in the past couple of years, and that is we have taste buds that are throughout our entire digestive tract. Now, those aren't wired to the brain like the ones on our tongue are, but our body is constantly sampling what's coming through the digestive tract, again, trying to determine if there's poison or toxins or anything. So it's always being tasted all the way through. After the mouth, we've chewed everything up. It's liquid, it's coated in saliva and enzymes, and now we want to swallow. That is a very active motion. Any movement of food or fluid from the mouth to the stomach requires an active muscular contraction coordination called peristalsis. You probably remember this from junior high science class, but peristalsis it's a very lovely coordinated series of muscular contractions that squeeze this tube and move food down and through. The reason our body initiates peristalsis is always in response to a stretch in the digestive tract. So anything that stretches our esophagus, stretches our stomach, stretches our intestines, stretches our colon, any stretch anywhere along the route will cause that squeezing and pushing down and out of the peristalsis. All right, after it's moved out of the mouth, gone through the esophagus, now we're going to hit the stomach. And what happens here? Food is further broken down through the mechanical action of twisting and squeezing and squashing food, and the chemical activity of hydrochloric acid being added to that food and further tearing and breaking down that food. There are no nutrients really absorbed in your stomach, but water, alcohol, some pharmaceuticals, some drugs are absorbed in your stomach. But again, not much absorption happens here except for those items. There are some things produced inside the stomach that are signals to other areas or function in other places in the body. Peptide hormones are made in your stomach, and they are involved with whether you're feeling hungry, whether you're feeling satiated, how quickly your stomach empties and moves the food along into the small intestine. Those sorts of determinations are made in the stomach, and the signals are sent to make that happen. Also, fat and protein requires special hormones and peptides, and those are also produced in the stomach to say, here's the food that's coming through, and here's what we're going to break it down with. Intrinsic factor, this is something that's produced in your stomach. It attaches to B12, and then when that food passes a lot further down into your lower small intestine, then you're going to absorb the B12 there. So that's a really complicated process to absorb B12. That happens either with food or with supplements, but the intrinsic factor must be made in your stomach. It must bind to the B12, and then it must be recognized and brought in lower down in the digestive tract. So, having our stomach functioning well, making all of the compounds that it's supposed to make, making all the acid that it's supposed to make, it's really important that this process works efficiently here. We'll talk a little bit about the next step, the small intestine. You can see on this slide, the colored areas, those are the 3 different regions of the small intestine. You're not going to be quizzed. I'm not going to make you memorize these. Don't bother about, learning their names so much. But duodenum is the first section. It's right after the stomach. So just where the stomach connects to the small intestine, that first section, the duodenum, a lot of activity happens there. A lot of sampling of what just came out of the stomach by the cells there to just determine how to best break it down. So a lot of activity in the duodenum. This is just a big general graphic about the small intestine. You can see from the left side there is just the overview, and then we zoom in as we go to the right. This tube that is shown kind of in the third graphic there, you can see that tube, it's open, and the interior is called the lumen. So if you hear about that, that's things passing through the lumen, just means the things that are going through the tube. A little closer on that graphic, so you can see again that tube there on the left. The interior of that, if you can see, there are circular rings made up of folds. that are all throughout that. That just creates a lot more surface area. So instead of our, intestines being like a little garden hose that's just a smooth tube, there's a lot extra surface area on the inside of that that makes just more area for foods to make contact with the body and to be absorbed in. So you can also see in there the little rectangular graphics. Each one is blown up and blown up, so you're seeing a smaller and smaller microscopic view. And in the center, you can see in that the area that's highlighted with the rectangular box, there's a little projection there. We call those little finger-like projections villi, or a single is called a villus. But that's an area where a lot of important things happen. When the food leaves the mouth, leaves the stomach, and it's already starting to be digested down and it's really liquefied, we call it chyme. Just so you know, that's the term for what's going through your intestines. We call it chyme. The small intestine, this is where nutrient absorption really happens. This is the big, powerhouse where we're absorbing nutrients for the most part. The cells that do that are called enterocytes. So on this graphic here, again, we're zooming in, and from that little villus, they've blown up, the big picture, and you can see that one little villus, that one little projection there is made up of a bunch of cells, just one cell. So the cells are like the little rectangles with the dot in them that also has the little hairy projections on one end, the microvilli, as it's called out on there. So with those, each one of those little rectangles is a single cell. That cell is called an enterocyte. And what's absorbed in the small intestine, it varies per region of the small intestine, meaning up high in your small intestine, certain nutrients are absorbed. And as you go down, different ones are absorbed in different regions. Like I had said, the B12 is only absorbed in the distal or lower, further part of your small intestine. So different things are absorbed in different areas. This is helpful to know if you've ever had resectioning or removal of a part of your small intestine. It's very important that you monitor and know which nutrients are being impaired by that piece of intestine having been removed. Okay, once the nutrients are absorbed through these little cells, that they take the nutrients directly to the liver. Everything that you swallow goes from your digestive tract straight to the liver. The bloodstream picks it up and goes right to the liver for processing. So same with all your nutrients. A little bit more about those enterocytes. So they are what creates and covers the whole surface of that villus. They're also sometimes called brush border cells. Really common if you're reading through different documents about digestion. Brush borders, how they'll explain these cells. And please notice that these little cells, those little white cells with the polka dot inside and the little hairy ends, that's just one cell. And then there's empty space. Then there's the red, blue, green area. The red is an artery, the blue is a vein, and the green is a lymphatic vessel. Same thing everywhere in your body. Every bit of your body has an artery, a vein, and a lymph vessel working together like this. They're always near each other. So with that, there's the one little cell, then the space, and then there's the bloodstream, essentially. And you can see if there's, that's a barrier. That brush border is a barrier that goes, as space between the chyme or the food inside the lumen, the tube of your intestines. The chyme is on one side. There's one little cell wall, and then on the other side of that is your blood vessel. It's a really, really thin barrier. And it's important that that brush border, those enterocytes, are protected and nourished and taken care of, because if they become faulty, then there can be gaps between those little cells, and things can sneak in from the intestinal contents, can sneak in past that cell into the bloodstream, and that can be dangerous. I'm getting ahead of myself, but I just want you to see on that graphic, one cell stands between what you swallowed and your bloodstream. Okay, what these brush border cells do, these enterocytes, they sample the contents of the chyme, right? The liquid food that's now passing through that tube. Those cells are sampling and tasting little bits of it and sensing, what is it? Did we just eat carbohydrates? Did we just eat protein? Did we just eat fat? What did we eat? And then depending on what you ate, then the cells are going to produce enzymes. So if you ate lactose, they're going to produce lactase to break it down. If you ate something that has histamine, they're going to produce DAO to break it down, etc. The other thing is, depending on what was sampled and what foods are present in the intestines, the enterocytes are going to signal to your endocrine system. If there's fat in that meal, then it's going to signal your gallbladder to release the bile that your liver produced and that the gallbladder has been storing. So bile is stimulated to be released by signals that the stomach and the enterocytes send. Then when there's sugar coming through and the enterocytes sense that there's now sugar in the digestive tract, they're going to signal to your pancreas to squirt out a bunch of insulin so that that can manage the sugar that you just ate, the sugar that would then be entering the bloodstream. Okay, so the small intestine does a really big job. Quite a lot of things happen here. What digestion is, I know I just threw that term out there, but what digestion really means is large molecules are broken down to small molecules so that we can absorb them. Complex carbohydrates. Lactose is a complex carbohydrate because it's made of two different types of sugar stuck together. So an enzyme will break that down until it's just single sugars. Protein will be digested down into smaller units, down to amino acids or even smaller or larger peptides, but there's never a complete protein that will be absorbed by your bloodstream. It has to be broken down to peptides or amino acids in order for them to be small enough to be absorbed in, passed through that one little enterocyte cell and get into the bloodstream. Fats, fats are really kind of different in their own way. They are packaged in your intestines. That little cell, that little tiny brush border enterocyte cell will bring the fat into itself, packaged up into this special packet that's called a chylomicron. And then that chylomicron is shunted off into the area where the red, green, and blue are happening, and then it's absorbed there. The absorption happens through active transport. That means that little cell, again, that little enterocyte, little white cell with a polka dot there, it grabs the food that's on the one side of the cell, the side with the little hairy projections. It grabs the food there, transports it through the cell, and then releases it into that space that then allows the bloodstream to pick it up. Things don't just get through out of the gut into the blood without passing through those enterocytes first. That's why they need to be, again, really robust and very tightly packed together so that there's no gaps between the cells where things are able to leak through. If we have that happening, there's a condition, we call it leaky gut. And it's where undigested protein molecules sneak past that brush border and they get into the blood. Any protein that's in our bloodstream that's foreign, that's not something our body made itself, is then considered an enemy, right? So if you get a protein from your food that sneaks past your barrier, gets into the bloodstream, your bloodstream will immediately sense that there's an invader, and it will start an immune response to that. Now, that's not supposed to happen if our gut is working efficiently and everything is intact. Again, foods will be selectively brought in and put into the bloodstream. But if we have disruption in our gut, something's irritating it, it can make these cells not work so well, not be so coordinated together, and things can sneak past them. And that results in food sensitivities or food allergies. So we always want to make sure that this small intestine is treated well and protected. In addition to that peristalsis that I talked about before, when your stomach or other part of your digestive tract stretches and then that pushing motion starts downward. Another way that movement happens downward is through something called the migrating motor complex. The migrating motor complex happens about 120 minutes or 2 hours after a meal, and it's a wave-like series of small contractions, and it sweeps the remaining chyme out of the small intestine to the large intestine. So it's preparing you for your next meal and making sure that everything is out of the small intestine and being dealt with in the waste factory, which is coming up next. The migrating motor complex will only perform this activity of sweeping and moving things down after a meal if you haven't eaten anything else after the meal. If you have a snack, if you have a sugary drink, you're not going to have that migrating motor complex functioning between meals. Again, this can lead to problems. So, not eating too frequently is a good strategy for keeping your small intestine working and cleaning house efficiently. So, my recommendation is generally 4 to 5 hours between meals is a good amount of time with no snacking in between. Again, the migrating motor complex happens 2 hours after a meal, generally speaking. We can often notice this because we hear like a gurgling sound or things moving through our intestines. Some people mistake that for hunger. Oh, I hear gurgling. I must be hungry. Well, no, that's just your body processing the food you ate before. So just get to know that that's a normal function. All right, after things have been processed, we got all the nutrients that we can out of this food, or the majority of them. Then things are going to be put into the large intestine. And then what happens next in the large intestine is, you can see on this graphic here, the colored areas are the large intestine. And down there where you can see the word cecum, cecum is the beginning of the large intestine, is where the small intestine meets with it. So that's the junction where the two meet. Then everything in the large intestine, as it's processed, moves up from there across the transverse colon, and then down which is the left side of your body. We're looking at this as if we're looking at a person. So actually that descending colon is happening on the left side of your body. Then that little curvy S curve we call the sigmoid colon, and that's the last area. Then we get the rectum and the anus. So this is the areas of your large intestine. This is just another nice graphic. It shows, if we open that tube and look inside, it does have some folds and things too, but nothing like what the small intestine has, and also for a very different purpose. But there are some bends and twists in the large intestine. The area of absorption here is different than the villi that were in the small intestine, very different. This has these things called crypts, and we'll zoom in. The crypts here are where we absorb water in the colon. The colon, yes, it's an interchangeable term. The large intestine, the colon, they are the same thing. Some nutrients are absorbed there, but mostly it's just water that gets absorbed here. And that's to conserve water inside our body, and also to firm up our stool so that when it passes, it's nice and firm and easy to eliminate. One thing I note here is that water is absorbed in great quantities in this area. And when we have toxins that are water soluble, our liver processes toxins, and it often packages them into a water soluble form. Then it dumps them into our intestines so they can be eliminated and removed. Well, if those water soluble toxins are in the water in our intestines, and it's being absorbed and absorbed and absorbed because you're constipated and you're not moving your bowels, and it's not moving down and out at least once every day, then the longer that stool can sit there in your colon and the water is absorbed out of it, more water soluble toxins are going to be absorbed. So constipation can end up making you feel really sick and toxic. So we want to make sure that things are moving out really efficiently. Any of the nutrients that are absorbed here go straight to the liver, just the same as things that are absorbed out of your stomach or your small intestine. Another, important function of the large intestines is to receive the dietary fiber that we can't digest. So of the foods that we eat, remember I said hunter-gatherer peoples, or people who still live a subsistence lifestyle, they eat 100 to 120 grams of fiber a day. And we eat a little bit too. Well, all of that fiber, it's nothing that we can absorb. It's nothing we can get nutrition from. It's just a waste product for us. When that dietary fiber reaches the large intestine, that transit time varies per person, but usually it's about 120 minutes or 2 hours after a meal is when all the stuff that we couldn't absorb or digest hits the large intestine. So about 2 hours after a meal, the dietary fiber reaches its destination. Here, it's going to absorb water, and then it's going to bulk up. When it does bulk up, that creates a stretch. It swells and stretches the inside of the walls of the large intestine. So that stretch, then the body recognizes, oh, time to move things down. So peristalsis happens. It's going to stimulate downward motion. Again, this is one reason that low fiber diet puts us at risk for constipation, which puts us at risk for being just generally more toxic, more sluggish. Here is one of the most important things to know about your large intestine, and that is the home to your gut microbiome. Microbiome is a term that's been used a lot lately. It's really out in popular media. You've probably heard of it. But what it means is it is the population of bacteria and yeast and archaea, these other microorganisms that live there. And again, either are neutral or confer a benefit to us. There are some dysbiotic ones. There's some bad guys that can get inside our bodies and they can overgrow and cause us illness. But for the most part, the microbiomes of our gut is healthy and contributing to our well-being. Dietary fiber is their fuel. So the fiber that we ate that we can't do anything with, it gets down to the large intestine and then they get to feast on it. They ferment it, and that fermentation provides fuel for them. But sometimes it also produces nutrients that we can benefit from. A couple of things that it makes, these short chain fatty acids are made from fiber, and those fatty acids can benefit us. Things like butyrate, that feeds those enterocytes. So those little cells, we want them to thrive and be happy. We want them to have a lot of their favorite food, and that food is butyrate. And butyrate is made by our gut bacteria by eating fiber. So fiber helps us to keep our gut healthy in multiple ways. And there's another short chain fatty acid that we make called propionate. And that one is a nice one because when that propionate is made in our gut, again, it gets picked up in our bloodstream, makes its way to our brain. And in our brain, it's appetite suppressing. It makes us feel more satiated. So dietary fiber, not only does it slow down how fast things move through our gut because it bulks up and kind of slows things, but it also reduces appetite by the production of propionate. So multiple ways that dietary fiber can help us to feel full longer. There are other things that gut microbes do or make or help us with. They make some B vitamins for us. They generate them on their own. They also make some compounds available to us. For instance, if you're eating lots of fruits and vegetables, those are chock full of antioxidants, right? Antioxidants are those pigments that make the colors, the reds, the orange, the yellow, green, blue, purple. All those colorful pigments are antioxidants. And antioxidants are really important to protect us against cancer and aging. And antioxidants that are found in foods are bound to their food molecules pretty tightly unless the gut bacteria help us to cleave them apart and allow us to break down and absorb the antioxidants. So without good gut bacteria, our antioxidant status will lag because we can't, even if you take a supplement of an antioxidant, your body can't use it without the gut bacteria being there. Same thing with herbs. There's some herbal medicines, some tinctures and things that when you go to take the herb for your benefit, it's not activated without the help of gut bacteria. So they do so many jobs for us. The gut microbes also send a lot of signals. Remember I told you when you chew, there's a nerve that helps to activate the chewing. Well, there's a nerve that goes all the way down from our brain, all the way down into our digestive tract. And that is the area, it's a way for our body to communicate. The brain and the gut can communicate, either sending signals down to tell the gut what to do or receiving signals from the gut about the state that it's in. And our gut bacteria, those microbes, they actually send chemical signals through our bloodstream and up that nerve. They go right to our brain. And those signals, if the microbes are in danger, they're out of balance, there's something about them that's not doing well, they'll send distress signals. And we'll sense that in our brain, but not know why. We won't know, oh, my microbiome is out of balance. We just know we feel anxious. So our anxiety, sometimes depression, can come from an imbalance in gut microbes independently. It's just them sending the signal, our brain is picking it up. So it's important to keep these guys happy, to foster them so that they can keep our moods more stable. Um, Gut microbes also help to train our immune system. You've probably heard before that 70% of your immune system resides within your gut. And that's because all that surface area in the gut, through all those little villi, microprojections, the crypts, all that surface area all throughout our gut um, is just allows a lot of bacteria and things to live there. And so those um, they train our immune system basically to know friend from enemy, right? To know if this is something that we should attack or not. And when this goes haywire, when things are offline, maybe your body doesn't actually attack something that it needs to because it doesn't recognize it as an enemy, or maybe it starts attacking friends and treating them like they're an enemy. And that's, like in the case of food sensitivities or things, our immune system becomes overreactive and allergic to things that aren't harmful. So getting, really healthy microbiome in your gut to help train your immune system properly can teach it friend from foe and really reduce allergic reactivity and overreactivity in that way. The way that we foster that healthy gut microbiome, remember I said our ancestors would eat foods from the soil. The soil microbes would get into our body, and just daily, they were always replenishing, getting more microbes every day that they eat food that came from the earth. We don't have that. We don't do that anymore. I mean, maybe you're a home gardener and you eat raw fruits and vegetables from your garden. Terrific. You're getting soil microbiome, soil microbes that way. But most people don't. We get our first round, essentially, the first time we have microbes introduced to our digestive tract is as an infant, right? The first interaction, if you're born through your mother's vagina, you will pick up in your mouth, your nose, you're going to pick up those bacteria as you pass through the birth canal. And then those microbes will, be swallowed and transferred into your gut. Also through breast milk. Mothers who nurse their babies, they're passing their healthy gut microbes. Their body is so smart. I just love how the human body works. A nursing mother's immune system will go and grab the probiotic bacteria from her intestines, package them up, shuttle them up to her breasts, and then release them through breast milk to the baby. So we first get these microbes when our mother passes them to us. So vaginal birth being the first, and then through nursing. So, a lot of C-section babies, a lot of women, feeding babies formula, many people don't get these first really important microbes. So another way, when parents kiss their babies, they can pass microbes that way. When you kiss them on the mouth, they can transfer them. But really, getting this in is from our mother, and then our bodies will build and grow that. Or, as we eat foods when we're older, we start interacting with foods from the earth, we can start getting them in that way. Anytime you take an antibiotic that kills bacteria, you're killing off the microbes in your gut. So since that's something, that's common in our current world, that people take antibiotics or use, herbal antibiotics, anything that kills bacteria in high quantities is going to affect the gut too. So how do we foster them? How do we make sure that you've got plenty of healthy gut bacteria? By eating foods that provide probiotic bacteria, that's one way, or taking a probiotic supplement to, provides some more bacteria for body to then grow and foster. But really, it's eating that is the big trick for how to keep healthy probiotic bacteria in your gut. You need to feed them the foods that they like. Foods containing fermentable fiber. That's what they eat. That's what keeps them healthy. That's generally the best way to keep a good, healthy microbiome, is just daily provide them the foods that make them thrive. Probiotic supplementation is available, and it's fantastic. It's wonderful that we can target specific microbes that are needed and supply them to the body, but it can lead to problems. Some people should not take probiotics, especially people who are chronically constipated or have any problems with gut motility. It's a risky venture if you're going to take probiotics without medical advice. I would say if you know that you need probiotic bacteria, you need to target the specific strains that you need and for a limited time, not just every day just because you can get an overload of them in your small intestine. All right. Um, Talking about dietary fiber, I'm encouraging you to eat dietary fiber because it's so good for you. It's so good for your gut bacteria. It's good for your moods. It's good for your appetite. It's generally a great thing. But what about gas, right? I have patients that just tell me when they eat high fiber foods, it hurts. So they really avoid eating beans, peas, lentils, raw vegetables, things like that, because the dietary fiber that's provided causes them bloating and pain and distension. If you have that happen, that's a sign you have a digestive disorder. It's not normal for you to get really bloaty and gassy right after a meal. So if you are eating and even before the end of the meal, you're starting to burp, or you're having to loosen your waistband, or you're creating a lot of gas immediately upon eating, that's a sign of a problem and you should get it checked out by your doctor. Because if you remember, we'll go back to dietary fiber hits the large intestine about 2 hours after you eat a meal. Then the dietary fiber should be feeding the gut bacteria that live there. If you're producing gas before that 2 hour time frame, then that means you're producing gas in your small intestine. That's not where it's supposed to be. Those probiotic bacteria are only supposed to live really in your large intestine. There should be just a tiny scant amount of them in the small intestine. And if they get that fiber that they love early on while they're still in our small intestine, they can produce a lot of gas then and causes a lot of issues. That intestinal gas can create all sorts of different problems. I'll talk a little bit about that in 1 second when I talk about SIBO. All right, how often should you have a bowel movement? It's another question people aren't quite sure of. If you remember, peristalsis is when the squeezing, there's a stretch in your intestine or your stomach, and then the squeezing causes things to move down and out. So in a perfectly working human body, what would happen is you would eat and then you'd have a bowel movement. You see this in infants, right? If you've nursed a baby or fed a baby, you feed them and then right away they fill their diaper. That's how a good digestive tract works. Same thing with dogs, right? Sometimes if your dog feeds on a schedule, he also poops on a schedule. And so that would be a really wonderfully working digestive tract for humans too. Although we also have some cognitive control over that, and people tend to not like to have bowel movements all throughout the day. So we can just have everything move down between meals and really just fill up that large intestine. So we have one big bowel movement a day. Generally, people will have that in the morning if they work that way. But yeah, either every meal initiates a little bowel movement or one big bowel movement once a day, totally fine. Less than one bowel movement a day, that's constipation. The gold standard for BMs are that they're well formed, they're easy to pass, and about 8 to 12 inches in a day. What does a good bowel movement look like? All right, maybe you didn't sign up to see this picture, but here it is. This is different types of stool. And type number 4 is the ideal. It's smooth, it's formed, it passes easily. Type 3 is a little dehydrated, it's a little constipated. Type 5 is, not formed, it's loose. So type 4 is really great. If you have the little lumps, that's really severe constipation. So just be mindful of, what your stool looks like and what that might tell you about your diet. If you have heartburn, indigestion, stomach pain, any of those symptoms I'm listing there, have your doctor run the tests to see what's going on with that, because those are signs that something is malfunctioning somewhere. And you don't have to just live with that. You don't have to accept it as normal. There's specialty testing that we can do. I'll talk just briefly about that. But in order to see about your microbiome, really, to see if you've got a good, strong population of healthy bacteria, we can test that through samples of your stool. We can also see if there are things that are coming through in your stool not digested as efficiently as they should be, telling us your enzyme activity is low, or if there's inflammation in your intestines, that'll show up in this sort of test. If you've got a high immune activation showing a problem. So this is a great test just to see if your large intestine is working efficiently and that you've got enough enzymes in your small intestine to be um, processing and digesting your food down. Okay, so this test result will look something like this, and it'll tell you if your bacteria, if you've got the beneficial type, or if you've got a lot of the dysbiotic or nasty type. It'll tell you if you've got yeast or not. So that's a great test to just generally tell the health of your microbiome. There is a test for a condition that's called SIBO, it's bacterial overgrowth. I need to correct that slide. Small intestinal bacterial overgrowth is when, for some reason, the bacteria, the microbes that are supposed to live in your large intestine have invaded your small intestine. And when they do that, they get to all the nutrients that we are supposed to absorb first. They can impair our nutrition. They can impair the function of our enterocytes. They can stop them from producing enzymes efficiently. They can cause leaky gut, which leads to food sensitivity. So having too many bacteria in the small intestine is a really big disturbance in your overall functioning. So it's something that we can diagnose. This is really a condition that's only been understood in depth in maybe the past 10 or 12 years. So it's really something that's kind of new, and we're learning more about it as time goes along. And now we have testing that's very specific that can definitively say if this is going on or not. So this is a test that's really simple for you to perform at home. The stool test that I mentioned before is also something you do at home. The SIBO test you do at home by collecting samples of your breath. And it's something, because what happens is the gas that's produced in your intestines by the bacteria that are there fermenting the food, they produce gas, and then that gas gets absorbed into your bloodstream, then travels to your lungs, and you breathe the gas out. So with that, we can tell if you ate something and then your body starts producing gas, we can see when was that gas produced. Was it early in the digestive process, when your food is in the small intestine, or is it late in the digestive process when it's in the large intestine? Large intestinal gas production, normal. Small intestinal gas production, problematic. So you measure that, and then if it turns out that you're producing gas at a high level too soon in the process, then we will treat you for SIBO. This is the next slide here is what the test results look like. It just shows that big peak, that big line going upwards is showing really rapid gas production happening in this patient's body. And you can see the rise started right at 40 minutes. Things started to go up. That means it's in the small intestine, and this person is positive for having a SIBO bacterial overgrowth. There's other testing we can do. Like I said, when you have leaky gut and that barrier is not functioning well, some food proteins can sneak past the brush border and sneak right into the bloodstream, where the immune system recognizes them as an enemy and starts an attack. When your immune system senses an enemy and starts the attack, the immune system also creates memory of that. So next time that your body sees that foreign invader, it can mount a really fast immune response against it. So our body develops memory of the foods that it has ingested that have become irritating to it. And we can test for that in a blood test. So this would be something you would come in the office for. We do a blood test to see if your immune system is showing antibodies against foods, meaning it is seeing those food proteins intact. And so that we can take those foods out, for one thing, because immediately your immune system is activated against them. It's going to keep fighting them and creating symptoms in your gut. So take the foods out. But that's not the end of the story, right? It's not the food's fault. It's the gut's fault, right? There's a problem in the gut that's allowing the food to inappropriately pass through. And so we need to heal your gut. And then you can start reintroducing those foods again. Once the gut is, solid and all those cells are tightly packed close together again, and they're a good barrier again, then you can eat the foods you previously enjoyed because your body won't let them sneak in. So the reason I'm going through that whole story and telling you that is there are tests available online now where you can send in samples, and your analysis will tell you what foods your body reacts to so you can eliminate those foods. Eliminating those foods, though, isn't the end of the story. So I don't love that testing being done and then just sent to people's homes for them to interpret on their own, because your naturopathic doctor is going to give you a lot more information about what that test means. If you have foods that are showing up, we need to know why. Why is your body letting those foods through? And we need to heal that disorder, whatever's causing that. So food sensitivity testing, better to have analyzed by your doctor, and interpreted so that you know what you need to do in the future rather than just not eating foods that you love. This is a standard test that shows results of foods that are tested, and then the score that shows if it's a positive or negative reaction. So this is just a small panel. I think there's 96 foods on this. We also have panels that have 184 foods you can test against, just so you can really get a good idea of what might be in your diet that could be irritating you. So that's that. Here are the summary of the tips, things that I've kind of said throughout this that I just want you to take away and remember. Eat only when your body's in a relaxed state. Doing otherwise doesn't allow your food to be digested well. It can just sit in your stomach like a rock. It can cause indigestion. It can cause reflux. It can cause malnutrition if you're not absorbing food because you're not actually digesting it well. So eat only when you're relaxed. Take some deep breaths before you eat. Use mindfulness. Look at your food, smell your food, feel the food, pay attention to it. Just really be in the mode of eating when you're eating. Then when you get that food in your mouth, chew it, chew it, chew it, chew it until it is liquid. Not only, again, is it good for breaking the food down better so you absorb more nutrition out of it, but also chewing is calming to our nervous system, and it's going to help. It helps with stimulating those enzymes that need to be produced. Eat dietary fiber to feed your microbiome, but don't take a probiotic every day unless you specifically know that you need to be taking one. And then take it for a limited time and foster the probiotics in your gut with the healthy diet. Then the type of bowel movements you want to have every day are about 8 to 12 inches worth of stool. Of course, it depends on the size of meals. If you're a tiny meal eater, you're going to have less stool to pass. Or if you eat very little fiber, you're going to have less stool to pass. But yeah, a good 8 to 12 inches a day is a nice amount to have moved out. Things that can kickstart that peristalsis, not just eating a whole meal, but drinking a glass of water. I often have patients who say first thing in the morning, they have to have a cup of coffee or they can't have their bowel movement. And I think that that's not exactly accurate, because it's not necessarily the coffee or the caffeine or the stimulation that causes the bowel movement. It's a stretch in your stomach from drinking the coffee. So you can also just drink down one big old 8 to 12 ounce glass of water first thing in the morning, and that will stretch your stomach and kickstart peristalsis and let you have that bowel movement. So, if you're a coffee drinker, great. I have no problem with it. I love coffee myself. But for those of you who are sensitive to caffeine or can't tolerate coffee, but want to kickstart that first morning bowel movement, drink a big glass of water just as soon as you wake up. All right, those are my tips. That is my presentation. I am open now for questions. If anybody has any questions, anything they want to clarify about what I spoke about, now's a good time. Go ahead and pop up in the chat. Okay, I am not getting any questions presented, so that's fine. I'm going to go ahead and leave it here. I'll go ahead and sign off, but just know this webinar is being recorded, so you can rewatch it at any time. And, those of you who are already patients of mine, please, reach out, ask questions if any of this brought up questions for you. If you feel like you might need to get some testing done to address the root cause of why you're having burping or abdominal bloating or gas or any of the symptoms I mentioned before, reflux, please do reach out to me. Let's get some testing scheduled. Let's get you digesting well and feeling better, because it really does impact our mood and our overall quality of life. So I want you to digest your best. So give me a call here if you need me, or reach out through the portal if you're my patient. I hope this has been helpful to you, and I'll see you next time for our next webinar. Bye-bye.